Redefined podcast.
What's up, everybody? Welcome to our podcast. We're calling it Redefined. We're the Monokian brothers. I'm Dr. Mike. I'm
Dr. Dave.
Joined by my brother, Dr. Dave, and business partner. So we're excited to have everybody here. You know, we actually did something similar to this back in the COVID days. Remember, we called it Tooth Talk.
Yeah,
back
that was
in the
fun.
day.
That was fun.
It was
Different.
Yeah, we did it all. It was all on Zoom actually, and we tried to do like YouTube live and all that stuff. And the kids were
I
involved.
got some good questions from it.
Yeah,
It was interesting.
Yeah.
There's some curious people, and
patients
kept in tune with people, which is cool. You know?
Yeah, especially when everybody was shut down, considering they considered dentistry to be non-essential.
Right.
But they considered liquor stores to be essential, which is always a little bit odd. I guess in hindsight, I could see why that was the case.
That helped a lot of people.
It did help a lot of people. help me get through it. That's for sure. So yeah, it's cool to actually be back and doing something new like this. We have a vision for this. We're looking to, talk about how our industry is being redefined, but also like how are other industries being redefined? There's a lot of stuff going on in the world today between like AI and it's insane.
I was thinking on my drive over here, even like ice cream has changed, right? Like now they're like you got cereal and ice cream. You got all kinds of different like ice cream shops popping up. Like how can one be different than the next?
Yeah.
Because just your plain Jane ice cream shop's just not cutting it anymore. Well, maybe it is, especially at the homemade ones.
Yeah.
There's a lot of them out there.
So Dave, I'll push this to you. How do you think that our industry's been redefined over the years, and like what's your thoughts on it?
Yeah, well, it's interesting because I guess we've been in practice for a while, so we've seen a lot of different transitions in dentistry, right? So I think the biggest thing that comes to mind is really the technology aspect of it, right? Mm-hmm. So lots of photography, digital x-rays have been around a while. You have 3D imaging, intraoral scanning, 3D printing. I mean, it's all stuff that's just making our profession that much better, improving accuracy, the precision of the work is better. Patients, they can understand a lot more about what's going on, helps us diagnose and see things a lot better. So I would say that's probably the biggest thing.
Yeah.
The other thing that comes to mind is now with social media and there's a lot of med spas, a lot of people that want to worry about their appearance and things like that overall. So like cosmetic dentistry, aesthetic improvements, whitening, veneers, straightening of the teeth. That's becoming more and more popular. Yeah. Not to say that everybody's a candidate, but at least a lot more people are inquiring about it. Yeah. So that part of it's pretty cool. I mean, those are the two main things.
What technology do you think is like the best technology that's out there right now? Like what's the coolest thing that's happened since you've graduated? Like what do you think is like the
I think it's I think it's just the intraoral scanning in general.
Yeah.
Because there's so many capabilities with it, right?
Instead of that like goopy impression stuff that people have to have.
Like everybody hates the stuff you're gagging on and whether it's the smell or the taste or the consistency of it, whatever it is. And now you could just take literally like something that's just taking pictures and a series of it to create a video, and then you see it up on a screen right in front of you and you can manipulate it. And it's
the wow factor.
It's really cool.
It's ridiculous.
It really is.
The accuracy of it is unbelievable, right? I mean, like patients are just like, they see that and they're just like, what?
Right.
This is insane.
I know.
Right?
It is. It's great because, and then you always have those files too, right? Like those other impressions with that goopy stuff you were referring to. I mean, there's expansion, there's contraction, the stuff goes bad over time. Yep. You got to throw out, if you need something new, you take a new one. But the file you can pull up and, just email it over or, put it into different platforms, and there's lots of capabilities with it. Yeah. So I think that's probably the best.
3D printing now too, right? I mean, that's definitely the next level at this point, right? I mean, you got to think like, for a while there, and it's still very hot, but like milling things, and like that's been pretty cool for many years now. But now like the 3D printing is like taking it to a whole new level, right?
It's wild.
You want to speak to that?
It's wild. Yeah, I mean, look, like there's lots of things that you can print, right? I mean, there's night guards, there's whitening trays, there's retainers, there's crowns, there's There's pieces of teeth that you can print out and then bond it to another part of the tooth. So, I mean, it just seems like it just continues to expand. So who knows where the possibilities are?
I know.
But you can really print almost anything that you have an STL file attached to.
Yep.
You throw it to the printer and it's like, voila.
I know.
You know, it's like within an hour.
And it's fast.
And it's fast. And it's fast and it's accurate.
Yeah.
And again, it's just, you know, another technology that just really is to the benefit of a lot of the patients.
Yeah.
So
Yeah.
that's cool.
You know, the interesting thing though, I found about I'm finding about the printer is like with anything, with any technology, like you have to operationalize it. You got to make a workflow for it, right? It's not like you can just, and the reps come out and they make it seem like you could just be like, nah, just put this in your office and boom, it's off and up and running and you're good to go. Like any piece of these technologies, like you got to like literally put together like, how are we going to make it work? Like, how does it work with the patient flow? How does it work from their next appointment? How quickly can we get things made? Like, how do we trim them? How do we clean them? Like, there's so many steps.
Lots of layers to it. There's troubleshooting aspects of it. I mean, it doesn't, you know, there's kinks with anything, right? So you work through all that. And like you said, you got to have a strong team around you that has the capability, the understanding and the education behind it.
Yep.
And yeah, I mean, I agree. It's not always where the patient can just come in and just wait for it. Sometimes it's something that may take a little bit longer between the processing and the trimming and polishing and things like that. So yeah.
Yeah, that's a pretty cool piece of technology.
It really
is.
is.
For sure.
Yeah.
You know, when I think of our industry, but I think it goes beyond just our industry. We've talked about this before. We've talked about it as a team before.
Mm-hmm.
I think the amount that our patients are informed coming in, like information is so accessible right now, right? Like you can get, you know, ChatGPT, Google, YouTube, like it takes a lot more to earn a patient's trust nowadays than it used to. Like our dad, you know, started the practice. For those of you that don't know, our dad started the practice in 1978. And like he, you know, he was an amazing dentist, not taking anything away from that. But there was a different level of trust back then. Like you could literally hang a dentist sign on a building and immediately people trusted you, right? Nowadays, it's like, you got to earn that trust, right? And I think that's one of the big ways, the things that we try to focus on at the practice is like, how do we build people's trust and do it quickly? Because unfortunately in society nowadays, like, you know, people don't trust the media. People don't trust politicians. I don't care what side of the aisle you're on.
It's true.
Right?
Yeah.
People don't trust their own neighbors. Like, you know, you used to be able to keep your door unlocked every day. And now you have to lock up your home if you want to walk around the corner. Right. It's, you know, we're in a,
I don't know if you ever seen Sebastian Maniscalco, right? The comedian.
Yeah, of course.
He talks about like, you know, now people knock on your door and he's like, everybody get down, everybody hide, get down behind the couch.
Yeah.
And it's like, you know, but like you said before, it was just like wide open, just walk in, whatever you want to do. Just walk in.
Right?
Yeah. So.
But seriously, like, I mean, like, so from a trust standpoint, like we're constantly trying to like figure out ways to build trust. And like that, again, I don't think dentistry is alone in that, but I think dentistry certainly is affected by that. Because information is so readily accessible. Like people can you can give somebody a recommendation and they can go on their phone and be like, is this legit or is this not legit?
True.
Right. I mean, so from that standpoint, it certainly has changed over the years.
And a lot of that's just about building relationships too, right? Like spending that quality time because look, like, you know, that trust level can either be earned, right, through time, or sometimes it's a given where, you know, in our industry where we work with other dental specialists, orthodontists, periodontists. So if they're referring patients in, sometimes that trust level is already high because they trust the provider that they were with before. And that makes sense. And look,
even trusting Google reviews.
Sure, right. Reviews are huge.
Right. You start trusting
with
what
anything,
people are saying.
Restaurants and healthcare providers, whatever it is, even, you know, hotels. I mean, you name it. Everybody's looking at reviews, right? I mean, that's what we do now. So,
And I usually look at the worst reviews.
you go 1 star.
I go to 1
You
star.
go 1 star
I go
first.
1 star.
Okay.
I'm
Yeah.
always looking. I'm always looking at the
I
1
got
star. I like that. Well, look, I look at the bulk of the reviews first, but then
Okay.
like I do look at the lowest
All right.
because I'm like, what's the biggest complaints that people are having? Right?
I got it.
Yeah.
Yeah, I mean, sometimes they're a little petty, but I get it.
They are petty. I agree.
You know,
I agree.
Everybody's entitled to their opinion.
Yeah.
You know,
yeah.
but
That's another funny Sebastian skit, by the way. He's like, I would never like something about like, he's like, I would never eat something at a restaurant and like the asparagus was bad. And like, he's like, go home and write a thesis about like the asparagus or something like that. It's like,
I know. Some people write some novels out
Yeah.
there, but it does help other people.
It does.
Yeah.
I know. What do you think that our industry is still getting wrong right now? Like, what do you think we could still do better with in dentistry?
You know, it's tough. There's like, I think there needs to be more of a tie-in with like the medical side, like medicine.
Yeah.
Because there's so much overlap in things that we hear from patients, whether it's cardiovascular issues or diabetes or sleep issues.
Yeah.
And a lot of this can really tie in with dentistry. And we've networked with a lot of different medical providers and helped patients from like an overall wellness standpoint,
Yeah.
rather than it just be like tooth by tooth focus.
Sure.
Right. Because that's just not what dentistry is anymore, or should be,
Right.
for that matter. You know, you really want to talk that comprehensive approach, and it's way more than just teeth and gums.
Yeah.
And really taking the time to understand kind of that full body connection. Right.
Right.
So
What do you think's it's a good point. Like, what do you think's holding back that like cross, like everybody working together in harmony between the medical professionals and the dental professionals, because there is so much crossover,
Yeah.
right? And I find it interesting because like even from, all the rave now you hear about everywhere is like gut health, right? Like, and digestion starts in the mouth. Like if you don't have teeth to chew, like you can't, like you're not going to have good digestion throughout your body, right? So,
right.
I don't know. I don't know.
I've always heard, I've always said, like, it's always been in the back of my mind. It's like your mouth is the doorway to the rest of your body.
For sure.
Right.
Yeah.
So like you said, like stuff you're putting in is not just affecting your mouth. It's going through your whole system.
Yeah.
And there's different medications that people are on that can have oral health impacts, right? For better or for worse. And it's just the reason behind it. I don't have an answer. Maybe it's just that, it's hard to be educated in all aspects of medicine and dentistry, right? I don't think there's not really a specialty that covers it all.
Right.
But I've always had in my mind, it's like, this is all just for the sake of the patient, right? So if I try to, we try to be their advocate, and if they're talking about things medically that I'm not aware of, I want to kind of try to help them find out,
Sure,
and there's plenty of resources. There's plenty of doctors that we know that may know another doctor in another type of specialty. And in the end, again, it's all just for the benefit of the patient.
Yeah.
And, that's how word gets around, and we're trying to reach out to as much of the community as we can. And, and so that's really what it's about.
You briefly mentioned it, but the airway component of it is fascinating, right? That's like, that's become such a big part in some dental practices, not all, but some dental practices. But like, we're just catching up to this, and it's like, it's amazing that the more we're learning about airway, the more you start to see the issues in different patients' mouths. You do an exam, you're like, some of the findings, you're like, this might be an airway thing. This might be a sleep apnea thing, right? I could speak from experience. I was just diagnosed with severe sleep apnea, and so now I have to wear the CPAP every night, which is, it's an experience in and of itself. But like, you start to realize like how much bad sleep affects you and how much good sleep affects you, right? Like all of a sudden you start sleeping better and you're more refreshed, and blood pressure's not as high, and like, so it's,
like you were saying, that overall wellness, right?
Yeah,
it's like that's what it's about. Like,
absolutely.
You feel better. You're more confident. You're interacting with people better. Whether you're in school or your job, whatever it is, when you feel more refreshed and more energized, you typically there's a better product. But
you would have never thought years ago, like dental
No.
school, I didn't learn a thing about breathing.
No, it really took off.
Right?
It really took off, and it did. And yet, what I always found interesting was you saw things in adults, or we see things in adults currently, and you say, "Wow, I wonder how we could have prevented this if it was caught earlier."
Sure.
Right,
Yeah.
because there's that whole like growth and development stage, right, as during childhood,
Yep.
and so now with us being in a family practice, this is something that we want to start looking at early, because we can get it to some of our other colleagues, some of our orthodontists or other specialists, and avoid surgeries or other complications down the road.
And that's
really
where we
impactful.
That's where we have worked. We've developed those relationships with like the ENTs and trying to get that like cross profession relationship to be able to develop that, because it is key. Like you can't just do it. We can't just do it on our own. Like it's like it affects everything, right? So
it does,
and that's like a perfect example of it. But there's other examples too, like you said, like gum disease affecting heart disease, right? And diabetes and things like that, right? So it's all there's so many links, and it's like I agree that's definitely an area where like our profession as a whole can get better for sure.
Yeah.
Right.
Yeah. And again, I think it's just about we really, I think we should really try to just reach out to different medical providers to see just where the overlap is, because I'm sure, we're missing stuff too, right? Like they may have certain medical conditions that we're not fully aware of how that could impact their oral health.
Sure.
So they could enlighten us on some things, us with them. And in the end, it's that overall benefit for the patient.
We'll get some. We'll get some on here. We'll get some medical professionals on here. We'll start. We'll see how they're redefining.
Anybody's listening and you're interested, then get first in line.
Give us a call. Give us a call.
So there's that, and then I think the whole like dental insurance area is it can definitely be tightened up. I think with dental insurance, sometimes dental treatment is like dictated off of dental insurance, right? And we could probably have a whole session just around dental insurance, but it's unfortunate because there's a lot of confusion in the public about dental insurance. And this is, this comes to mind that maybe part of the reason there's such a separation between medical and dental is because the insurances are different.
Yeah, that's true. They're very different.
They're completely different.
Yeah, it's like night and day.
Right.
Yeah, for sure.
But sometimes patients can get those confused.
Yeah,
and they give us their medical card and say, no, you need you have dental insurance. Right. And it just behaves totally different.
Yep. You had a stat on that. Remember, like we've talked about this before about like the something about the how much your maximum is for the year. I think it's like $2,000.
So it's anywhere between like $1,000 and $2,000, right?
But it's been the same. So it's been the same maximum
for like
since
40 years.
Yeah, right.
Since dad started,
right,
in like 78, 80, right around that time, it's been the same,
right.
And dentistry wasn't as expensive.
Yeah, but how much was a crown back then? For example,
maybe a crown was $300-$400, right? And so that $1,000 to $2,000 got you a good amount of dentistry to be able to rebuild the mouth for certain needs. So now there's still $1,000 to $2,000. Premiums are higher, copays are higher, premiums are higher, and crowns are way more than $300 to $400.
Yeah.
So they're covering just percentages of that, right? And then there's the whole in-network versus out-of-network. Right. Like I said, we could probably go on for the next few hours about it, but again, dentistry shouldn't be, there shouldn't be recommendations based off of just whatever your insurance covers, right?
100%.
I mean, because then you're just telling people a very select amount of things that you may be noticing,
right? Because
in your mind, you're like, whoop, they already maxed out.
Yeah.
Can't tell them anymore.
Can't tell them anymore.
Right. So.
Yeah, for sure. Yeah. I agree. We could spend a long time.
Yeah, it's an interesting topic.
Yeah.
But
what do you think that patients misunderstand the most about dentistry? And maybe that's what it is. Maybe it's dental insurance. But
yeah, I think insurance falls in there for sure.
Yeah,
because it does create a lot of confusion, and rightfully so. You know, I mean, sometimes they have to pick up off of a list of people that they're allowed to see,
Sure.
right? And even though they may want to see somebody else based on somebody getting a lot of good reviews,
Yep.
but they're not in their network, so they're kind of hamstrung a little bit with that.
Yeah. What other things? What other things do you think the patients
I think the big
misunderstand?
thing is like if it doesn't hurt, it's fine.
True. Yeah, that's
That's
a good one.
And look, keep in mind, like that's not a good philosophy to live by.
No.
Because look, if stuff starts hurting, it's generally more expensive
100%.
and more time consuming.
Yes.
Which the two things patients probably hate the most
Yep.
is their time and money.
You're right.
Right? Most
Absolutely.
of us, right?
Yeah, for sure.
So like gum disease, for instance, right? Like gum disease still up there, number one reason for tooth loss,
Yeah.
and zero pain.
But even cavities.
Zero pain. Cavities too.
Cavities.
for
I mean,
sure.
it has to be a pretty deep cavity for somebody to actually feel it. I mean,
Right.
it can't just be like just through the edge of the tooth. It has to be like, getting close to the nerve, which is, it's a pretty big cavity for somebody to feel that.
I mean, how many times do you hear? You look at an X-ray, there's a cavity, you make the patient aware, they turn to you, but it doesn't hurt.
It doesn't hurt. That's the classic line.
You try to catch
I
them a
know.
little before that.
It's true.
I know
No.
it doesn't hurt.
I know.
But
I
here
know.
it is. And the cool thing is, going back to the technology, now that like AI-driven software programs that integrate with the X-ray systems,
cool.
the
Really
digital
cool.
X-rays, you can make an X-ray the size of the whole computer screen or
Yep.
TV.
Yep.
And it's just all it comes down to is it's just more education for the patient.
Yep.
And when there's higher levels of education for the patient, they can make better decisions.
They're more empowered to make
They're
decisions.
More empowered to make decisions.
That's it.
We don't make decisions for patients. No. We lay out everything we see.
Yep.
Let them know some of the risks or consequences if it's untreated,
Yep.
and then the options dentistry has to offer, which are way different.
Yeah.
And there's way more options, some very creative things out there than were there 20,
Sure.
30 years ago.
But I think the one of the, you just touched on it, but the consequences or the risks of doing nothing, I think that most people just aren't always aware of what could happen if I don't treat this problem, right? Right. And most people understand that if you don't treat a cavity, it's going to get bigger. But not even everybody understands like gum disease, what can happen in a situation like what can happen with a cracked tooth, what can happen with somebody that's worn down their teeth or is grinding their teeth, right? Like there's different things that happen over time as a result of leaving these things untreated.
Right.
And you hit the nail on the head. I mean, we feel like it's our obligation always to just be like, here's the problem. Let me simplify like what this means for you or what potentially could happen. Because like, look, we don't have a crystal ball. Like we don't know what's going to happen,
Exactly.
right? Like nobody does.
It could stay like that forever.
Right. Yeah. Some things.
If there's
could
a
stay-
crack or
right,
something.
Exactly. Exactly.
We've seen plenty of things last a long time that maybe are a little higher risk.
Yeah.
but-
Yeah. And the options out there, like you just said, like they're just like they're becoming more and more expansive, right? I mean, like going back to the 3D printer. I mean, that's gonna that's a game changer.
It really is.
Right. I mean, now all of a sudden you're starting to print things that you can, bond onto teeth and things. It's wild.
Right.
It really is.
Right.
Yeah.
Well, it's different because again, going back, and that's what's really cool with our family, right? It's like I felt like we grew through the generations of dentistry,
Yeah.
right, and got to see through a lot of different lens. But it's
On our kitchen table.
in the
Oh,
yeah, right, exactly.
Right. Our dad and
with just like
and the lab
molds
guy.
of teeth
Molds of
everywhere.
teeth.
It was like, all right, is this stuff sterile or is this like, can I touch this? Am I going to
Yeah.
break something?
Right after dinner.
Whatever.
It was-
Yeah. So yeah, but then it was just like, all right, like people would come in, and maybe it was a lot to do with the trust thing, right? Like people would come in, they expected the dentist to tell them what the problem was and how to fix it.
Sure.
It was like, here's
That's
the
it.
cavity, you need a filling. Here's a broken tooth, you need a crown.
And they
Here's
didn't question it.
You need a lot of
No.
people didn't question it.
Yeah,
No.
I mean, back then, like, no.
No.
I mean, it was just that. Okay, that's
No.
what the doctor says. That's what I got to do.
Right.
And it's that part of it's changed. And look, I could speak to that from my own personal experience, right? I go to a doctor. I'm like, I hear what the doctor has to say, and then I'm looking into it a little bit more myself, right? I'm like, all right, not that I don't like trust the doctor, but like I still want to kind of keep myself educated at the same time.
Yeah,
so.
the education is huge.
Yeah,
the
for sure.
education is huge,
Yeah.
and that's where all these resources that we have available to us is helping so much.
Yeah.
Because I mean, look, the way we bring new patients into the practice, they're in the practice for about an hour and a half. I mean, the doctors are spending 40, 50 minutes of uninterrupted time, and we're taking photos of certain teeth, and it's up on a screen. So it's very easy to kind of own and understand what's going on.
Sure. Yeah. Yeah.
And because it's hard to see certain areas of the mouth. I mean, by just looking in a mirror, or you're at home and trying to have your, somebody else take a photo inside your mouth, and
we used to, I mean, when both of us started, we didn't even have digital X-rays at the time.
No.
Right. We were looking at our X-rays, and they were like the size of like almost a quarter practically, like $50, and like you're sitting there holding it up to a light,
you're shaking it, holding it up here.
And now you blow it up, like you said, you could blow it up the size of a big screen plasma television or whatever, and like it's unbelievable.
It is,
right?
It is.
Yeah.
It's nice. I mean, you want patients to feel comfortable about the decisions they're making, right?
Of course.
I mean, that's what it's about.
Absolutely.
Right? It's that whole like code discovery, code diagnosis. Like we're working with them. In the end, they're making the choice that they feel is best for them. And sometimes it's to do nothing and just monitor it. And that's cool.
That's fine.
And that's fine.
Yeah.
And sometimes it's choice 1 or choice 2 or choice 3, but they understand.
Yeah, they understand the pros. You have to lay out the pros and cons. Because not every option is equal, right? Like this option, if you go with this option, you're kind of giving up this, but you're gaining this. You go with this option, you're giving up this, but you're gaining and sometimes there's not a perfect option. It's just like what are you willing to trade off on? Is it cost? Is it maybe aesthetics? Is it strength? Like there's a lot of different factors that can come into play when coming up with these options and just laying it out for the patients to make the call. But we got to do it simple. Like you can't get into like the dental jargon, right? And be like, let's talk about an all zirconia crown versus an Emax crown. Like nobody's like, like, what are you talking about here? Like it's so anyway, but yeah.
Don't dental them to death.
Yes.
Right. Just,
And I remember when
it simple.
When I first started out, like I feel like that's the guilty thing for like any new docs. Like, and again, me included, starting, 20 years ago, it's like, let me tell you what I know.
Right.
And it's like, and you confuse the crap at everybody.
Right.
And they're just like, what?
Yeah,
and then
it's way
like,
too much dental school terminology.
Information overload.
And it's just like whoosh, right over their head.
Yeah.
Eyes are glassed over.
For sure.
It's like, all right.
Yeah.
Lost all kind of comprehension on this one, right?
Yeah. What about like, so, and this might relate to this too, but like, what do you think frustrates patients the most about our profession right now?
I think it's the big one is just lack of understanding what the issue is.
Yeah.
And again, that goes back to the education stuff that we just talked about. I hear from a lot of new patients that one of their concerns is that every time they come into the dentist, they feel like there's a new issue that's popped up.
Yeah.
And it's like this, like it's like chasing your tail over and over. It's like you kind of already come in to the next visit with the mentality of, all right, what now?
What now?
Right.
Yeah, right.
And so again, encouraging newer dentists, especially, like, don't tell patients just what you think you want them to hear, or what maybe you feel like is just the only priority. Try to tell them everything you're seeing. You're almost just like a news reporter, right? I mean, it's like, it's rainy, it's windy, it's a little cloudy. Like, just don't hold it back.
Right.
Now, sometimes it can tend to overwhelm patients, right? But we feel like it's our responsibility to tell them everything that we see. The clear picture of that is not everything always has to be treated right away, because there's certain things that could be high priority. There's certain things that could be, we're keeping an eye on. There's certain things that are elective, something like whitening, is that whatever. But
it's amazing that we even have to, like, you have to mention that, right? Because that's real, like 100%.
It's real.
It's definitely real. Like about, patients going to their office and, their dental office and hearing something new every time. And there are philosophies out there, like you said, that like, it's like, well, don't give them too much. Right. But could you imagine if that was like your primary care physician? You went to
like you got a blood test done.
They're like,
I'm only going to tell you a couple things.
I'm only going to tell them about these two things. I'm only going to tell them about their cholesterol and their, their A1C, but I'm not going to tell them anything else right now. I'm just gonna I'll wait to tell them that their next physical. Like, what? That's insane. Like, no, like our responsibility is to lay it out, right?
Yeah,
just lay out what's going on in people's mouths for sure.
That's it. I mean, there's obviously, again, the confusion about the insurance, like we talked about, right? Patients get really turned off with like a salesy type of approach. I mean, it really shouldn't be, there should be no like trying to convince patients to do certain things, like that scarcity tactic. You just, I remember Dad told us like years ago, I'm sure he told you the same thing, but it's just like, just be real, just be honest with people, right? Just be completely honest, and you'll reap the rewards and the benefits as a result of that. Because look, we live in, I mean, especially this area, there's a lot of intelligent people, right? There's high dental IQs, right? Like people know what's going on. People get second opinions. You have ChatGPT, you have all kinds of things that people can look into before they even step in your door and kind of question what's going on. Yeah. So if you don't know something, you don't know it. Yeah. Right. Yeah. And like I said, you try to help them find out, but if you do, then just be honest about it. That's all you can do.
I mean, I think patients can tell when somebody's not being honest, right? Like when somebody's like trying to like get scared into treatment, or like just using scare tactics and things like that. Like like I think they can tell when it just comes across like there's no way to hide it.
I think so,
right? For sure. Yeah. So all right, how about, where do you think dentistry is becoming more transactional than relational?
Well, again, the relational part, I'm going to kind of flip it for a second, because like the relational part to me is just about spending more time with people. Sure. Right? Like, I don't love like the mass model, like the mass amount of patient model, right? Like, let's try to get as many people in as we possibly can, maximize everybody's insurance to the best we can, but spend, typically, I mean, after a cleaning, a minute, 2 minutes, right? Yeah. I mean, that's why we restructured the way we bring new patients into the practice, is because I don't just care about their teeth. I mean, I want to get to know them as people. I want to understand what their history's been up to this point. If they've had any experiences that weren't favorable. Because look, I mean, dentistry's up there as far as fears go, right? I mean, that's real.
Without a doubt.
Right. So,
and and by the way, a lot of that stems from childhood.
100%. I was just going to say that. Yes, absolutely.
I mean, that's something. And I think as we're getting better at dentistry, hopefully like we're shaping childhood memories of dentistry that aren't so like harsh. How many times do you ever hear a patient say like, oh, they never even used to use Novocaine on me back in the day. I just drilled my teeth.
Tooth smoke, grip the chair. Just
and that
deal
just
with it.
Affects the profession for decades to come, right? I mean,
and it's not fun. It's like we're smiling, or it's not funny.
No, it's not.
It's not funny, because I wouldn't want to grow. I mean, look, obviously we grew up with Dad doing our dentistry, but I wouldn't. I have a lot of empathy for those patients, because you can't. Those stick with you forever. Those experiences. I don't care how big or small they are.
I'll give you. I mean, look, I always tell patients this. And you weren't on this flight, but like, growing up, we were coming back from out west. Me, mom, dad were out there, and we were flying over the mountains, the Rockies. We hit clear air turbulence. Plane dropped out of the sky. I remember like the cart in the center of the aisle hit the ceiling. Like it was terrifying. It was unbelievably terrifying. We thought we were going down. I was in middle school at the time. I don't like flying ever since. Like I get nervous every time. You do know. But it's the same thing with that. I mean, it's a childhood experience that shapes your life and how you're, what you expect. Now, every time I feel a little bump on a plane, I'm like, I'm gripping a little tighter. Yeah. Or order another drink with, either one.
That's right. Yeah. I hear you. No, and then there's also like movies out there that don't depict dentistry in the most favorable way, right? Yeah. So it's like so our goal is like just try to layer on top of that as many good experiences as you can, and do things at a pace that's comfortable for the patient, not that's comfortable for you, right? Patient wants to treat. Patient has a whole mouth of stuff going on, wants to treat one tooth at a time because that's their comfort level, then we treat one tooth at a time.
Sure.
Other patients want to come in, they want to treat 20 teeth at one time, so we'll treat 20 teeth at one time.
Yep.
And there's everywhere in between. So
yeah.
you know, it's just that very like customized approach. But
well, I would say in regards to the transactional versus relational, one thing that just popped into my mind was, you know, and I don't know how many people know this or not, but like our profession, again, like probably a lot of professions, is being taken over by private equity, right? You know, it's the day of the private dental practice is dying for sure. I mean, it's amazing how much private money out there is investing in dental offices, buying up dental offices, and just changing. The model is changing for sure, and that's where it's becoming very transactional, right? And that's where it's becoming more quantity based for sure, right? They want to get more people in the office. Maybe wait times go up as a result of it. But it's interesting to see that, right? I mean, compared to, again, when we first graduated, like that was around a little bit, but like not.
There was a lot of private practices back then.
There were a lot
20 plus years ago.
It was way more than there are now. Way more. And I think it just keeps going in that direction, you know. And
right.
It's almost like it's just not stopping, right? And we're just seeing it all around us.
I just cringe a little bit when it's like dentistry is almost like treated as like a commodity.
Yeah, I know.
Right? Because again, there's so many. I mean, people see their dentist a lot more than they see their physicians.
Yeah,
general physicians
for sure,
or medical providers.
Well, dentistry's gotten that right. We've gotten that. We've gotten that right from that. Like I remember going to my eye doctor one time, and he was like, "How do you guys just get people back like every 6 months?" Like, and like he's like, "I'm trying to get people in for their annual eye exam," and like it's just like, and dentistry has done well with that, right?
They do, yeah,
and it's done a lot better than even than medicine for sure. Like you know, people miss their physicals. You know, they're not going as routinely, like you said, as they're going to the dentist.
Right.
It's interesting how that kind of worked out.
Because here's the thing: like if you're going regularly, you're in that more preventive, proactive, like timeline,
sure,
right?
Yeah,
or approach or whatever, however you want to call it. But and so through that, dentistry is a lot more pleasant. It's less expensive. You come in, cleaning, maybe some x-rays every now and then, exam, you catch up, you see familiar people, you and you can bring the whole family in.
Yep.
They can all get treated at one time if they want to. And you see over the long run that there's less big issues that pop up as a result of it.
Sure.
Now there's other people, look, they want to wait till issues pop up, right? And that's the world that they live in. They wait for teeth to break or teeth to hurt. And look, that's fine too. There's no judgment, right? But it's just seeing it for so long. The right way to do it is to come in regularly. Just keep eyes on it.
Right. Just make maintenance, right? Get
That's
people to the point where it's just maintenance. It's at some point. So
yeah.
Well, this was awesome. I enjoyed this.
Yeah, I did too. This was great.
This was a lot of fun.
This is cool.
This is like just us hanging out in the living room.
I know.
Right? Yeah.
It does bring back the memories of the tooth talk.
Oh yeah.
It's a little more professional, but
yeah, it is a little bit more professional. We had the kid running around.
We were like down my basement.
Yeah, it was just but it was the best
Zoom.
We could do.
Yeah,
the best we could do back then.
Yeah, right.
Now we got Tyler here helping us, and he's the man.
Yeah,
so appreciate you, Tyler.
Thanks, Tyler.
So yeah, thanks.
So this was good. I look forward to more, and like we were saying, like having other professions on here. It doesn't just have to be dentistry. I mean, I know we're talking about dentistry, but
I'm inquisitive. I like to learn about other things. Like so I think that and
of course,
a lot of times there is a link somewhere to dentistry, right? So somehow, some
we'll
way,
make it.
We'll make the link.
We'll
find the link somehow for sure. But yeah, no, I'm excited. I think this could be really cool. So yeah, thanks for doing this with me. I think this
absolutely
is awesome.
It's fun.
Yeah, so
cool.
Hopefully we'll see you guys again.
Yeah. Until next time.
Absolutely.